So the nurses here at VNA are one of the reasons that I was attracted to come here. They have tremendous passion and compassion for what they do. They are persistent in trying to find ways to solve problems. They are tremendous at building teams. They are wonderful leaders, and above all, they're selfless.
I've had the opportunity to work with some of the most amazing nurses in this organization, and it seems as though everybody that works here has that same mission-driven attitude to just go above and beyond.
But they're also saving people's lives in many instances, identifying situations that aren't safe and fixing them, getting people to the right care at the right time.
It's rewarding. It's a pleasure to be out there in the community that I live in, to be able to help. This is what I live for. I couldn't see myself doing anything else.
The importance is hope. Every patient should have hope. I think employees that go up and go about and above really facilitate people's hope that in every situation something can be solved.
I think that in essence is what the VNA is that we're not just there to take a blood pressure or take a look at lab values or try to just look only at the clinical side. It's also the emotional side, the spiritual side of the patient, the family dynamics, because we're in their home environment. So we're seeing the whole patient and family.
You know, one of the best parts of my job is getting letters from patients and families, hearing from the community about the great work that's done by our nurses. It is heartwarming, frankly it's humbling.
The letters that we receive show that the patients love the nurses, that they become angels are some words that they use, that they are like a family member, that they would be happy to recommend them to anyone in the community, and they have tremendous trust in them. I'm exceptionally proud but also inspired. Many times people will say to me, how do you get up every day, Ellen, and travel north to south and attend all these meetings and functions? And sure, it's tiring, but just when I'm at the end and I'm very tired, I'll get a call from a patient or I'll see something a nurse did, and it energizes me for the rest of the day, the rest of the week, because it's so inspiring to see them going out in all kinds of weather, with all kinds of situations, with hardships. We see patients and families at the worst time of their lives, and it's very, very important that we stay focused and provide high quality care. So it's extremely inspiring to me.
So it was a Saturday. I was scheduled to work and I got a call from a patient caregiver who stated that she took her husband's blood sugar and it was low, so she called 911 and couldn't get a hold of anyone to come, and she decided to call me. I told her to elevate the patient's head and put sugar under his tongue, and I'll try to get there as soon as possible. And then I called Rebecca, who's the clinical manager, and told her what was going on. She told me to rush to the patient home. It was 45 minutes away. So I rushed to the patient home, me and the escort, and ran up 3 flights of stairs. When I got there and assessed the patient, he wasn't breathing, no pulse, so me and the escort had to pull him off the bed and put him on the floor. I started 911. Rebecca, who's the clinical manager, and Mona, the case manager, was on the phone instructing me what to do. We did the CPR, and around 10 minutes later, the EMS came. The patient blood sugar had risen, and with the help of Rebecca and her guidance, it really helped to save this person's life. I mean, we were there, and had the EMS been there, they could have done it, but we were the one that they trusted to call, and we basically saved his life.
It was a holiday weekend, and the weather was bad and expected to get worse. We had some snow. So the visit didn't take place, but there was a little dilemma in the home. The daughters were panicked because the patient was discharged without medication. And so my first step before even getting into the home was, let's get the medications in the home. So I tried to reach a doctor who was on vacation, and there was just a succession of fragmented care that I tried to put together, realizing that the patient didn't have what she needed. I also called the hospital nurse to see if there was anything that could be done. Perhaps I could pick up prescriptions from the hospital and bring them to a pharmacy or to the daughter, or have them pick them up. And they told me no, because they needed to reach the doctor, who had then gone on vacation. So eventually I again reached the doctor's office, and I explained to the person who answered the phone, we didn't get anywhere. I didn't reach a doctor, we don't have prescriptions, we don't have medication. Through all this, the DME company did deliver nutrition. However, it was not the exact calories that were prescribed. So I called over to the home health agency again. I said, well, we have some nutrition in the home. We don't have a nurse in the home, and we have a different type of nutrition. Is there a dietitian that could just let us know if this was okay? And they kept telling me, yes, someone will be coming. And I would call the daughters and say, I did reach someone. We went through this for a day or so. Finally, the doctor who the patient had been with in the community called me back, and I explained the scenario, gave her the medication list, and then proceeded to give her the pharmacy phone number. And she asked me what she should do. I said, please call in these medications, because the patient doesn't have the medication in the home. She eventually did. The pharmacy delivered the medication, and then once the weather cleared, the nurse did come in from the home health agency. So the patient was able to stay, did not have a hospitalization, and also throughout my episode of care, she stayed home. This whole helped me improve in my care, in that now part of my script for when I talk with the patients is to ask before discharge, is to remind them that they should always have prescriptions and understand about the discharge summary before taking their loved one home from the hospital.
I cover a retirement village in Freehold, New Jersey, and one of the clients I have there, taking care of her for about 7 years. And recently, she's really become more debilitated over the years. Her husband and her have been married 50 years, actually 55 years this year. And recently he's become very upset because he used to lift her into the car from the wheelchair, and he can't do it anymore. He's 75 years old, and he dropped her about 2 or 3 times. And I thought, how can we solve this problem? The MS Society does give them a van twice a year, and he knows what the van is like with the lift, and he said, I would love to have a van like that. So I thought to myself, the GoFundMe account would be a great thing to start a fundraiser for them. So their daughter, I requested her to write up a nice story, which she did, and we got it posted on GoFundMe. And then I said to Mr. Colatrella and her daughter, we really have to get the story out there, so why don't we contact the Asbury Park Press, because they have a lifestyle section and they might be interested in the story. And they were called, and they were very interested and came out. And on March 17th, they did a beautiful piece on them. You know, they came to their house, and they also had a picture in the background of their wedding day, which it was April 1960. And so many people were inspired by the story that $8,000 was collected towards a used van. They're not looking for a new van. And so the other day I went there because he did run into someone that had a van for them, but he thought it wasn't going to work out because they wanted $2,000 more. And these people did not see the story till they were made aware of it. They read it, and they decided to forget the $2,000, so they are going to get the van. And it's a beautiful van. It only has 55,000 miles, and he's tested it, and it's wonderful. So in about 3 weeks, they're going to get their van.
I began working with this family about 1.5 years ago. The little girl was a typically developing child when she was born, but her parents recognized that she had some problems as she got older and wasn't reaching her developmental milestones. And the doctors couldn't see anything specifically wrong with her, but at some point when she was about 1 year old, the mom approached the early intervention system and asked for an eval. And our teams evaluated the child and recommended therapy. And when we started working with this little girl, she was about 1.5 years old, and she was able to roll around. She couldn't sit unsupported. She couldn't walk. She couldn't talk. She couldn't feed herself. She was a very pretty little girl, and she was getting big for her age, but she was really acting more like an infant. And her parents knew there was something seriously wrong, but the doctors did many, many tests and couldn't find a diagnosis. So our program started working with her motor skills, getting her to purposefully move better. Taught her how to army crawl on her belly, and then sit up by herself, and then pull to a stand at furniture. And today she's 3 years old and she's walking. She waddles a little bit, but she can go up and down the stairs with help. She loves the water, loves to swim, and she developed her motor skills very nicely. Took a lot of effort on the part of the parents and her babysitter and the staff, but she's had a very dedicated physical therapist who has really helped her a great deal. Along the way, we also introduced teachers who worked with the family to teach her communication skills. She still is not verbally communicating very much, but she is learning to use an iPad, and she can indicate with pictures. She has a picture book, and sometimes in early intervention we use pictures to help a child express what they want. And she can pick out the pictures of the item that she wants and hand it to her mother or her caregiver, and you can even make up a sentence with pictures to give a short phrase or something like that. And she made beautiful progress through our time with her. She still has a long way to go, but her family was very pleased with their support that they got from the early intervention program.
The future for VNA Health Group, the future for nurses, community health nurses, home visiting nurses is incredibly bright. The opportunities to make a difference, to help people in need, I think are growing. I think there's a growing realization in American healthcare that we have to figure out how to help people at home and in community settings so that they're not unnecessarily hospitalized or unnecessarily placed in facilities.
Well, the future is, as Dr. Landis has brought us to many tables, is partnerships. And the better that we can improve our practice and improve quality, stay focused on that at all times, providing excellent patient care to our family, our community. We will be involved with more partnerships, we will grow stronger, and nursing will have a tremendous advantage in this field.